Hey, welcome back to the Coach Johnny Mac Show. Got a real good guest today. We're gonna talk the world of concussions. Concussions is a word that's used and thrown around in contact sports. Um, but to be honest with you, I'm in the hockey world and I don't know too much about them. I know you it's brain trauma, but what we've done is we've got an expert in the concussion industry, so to speak. I've got welcome. Doctor. We've got Dr. Cameron Marshall here, and he's an expert on the traumatic brain injury, if you will, and we're going to kind of walk through Dr. Marshall's journey, as well as talk about the things that sometimes people don't want to talk about, and tune in, and if you have kids that are playing sports, listen to this because he does, and I do, and it's real important. So welcome, thank you for taking the time today to sit and talk with us.
Thanks for having me.
Awesome. So, Dr. Marshall, you're in Southern Ontario, Oakville area. What brought you to this point to be an expert on the concussions?
That's a long story. Well, I mean, I grew up playing hockey, and we never really thought much of it. I mean, like most people from our generation or my generation, it was, oh, so-and-so's got a concussion, they're out for a couple days, and that was kind of the end of it. We didn't really think much of it. They may not even be out at all. It was just kind of get back in there and how do you feel? I feel good, and I played up until the junior level. So I played in St. Mary's. That was the highest I got, was junior B in St. Mary's. And then I started playing lacrosse for Western University. And I was taking kinesiology at Western. So I got into athletic injuries. That was one of the courses that you could do. And if you kind of kept going with that particular program, by the time you got to fourth year, so you had to kind of apply and get accepted into the fourth year athletic injuries program, and they would pair you with a sports team. And so I put down, I wanted to be with the men's hockey team. So I was kind of the trainer for the men's hockey team, dealing with all the injuries and stuff, working closely with the team doctors and whatnot. So I got really interested in the sports medicine world. Originally, I was going to go into orthopedic surgery. So I would scrub in on surgeries and kind of shadow those guys around, and chatting with a lot of the residents and fellows, they would be like, there's no jobs for ortho, right? I think at the time there was about 50 or so fully trained orthopedic surgeons in Canada that couldn't get jobs. And so it's just because there's just a lack of OR time and a lack of resources. So it didn't really look like a promising path to spend the next 10 years doing ortho and not be able to do anything with it. So I kind of switched tacks and I started thinking, okay, do I want to do physical therapy or whatever? But ortho appealed to me because it was working with your hands in that kind of sports medicine, sports injury world, which I was really interested in. So when I was working with the men's hockey team, a couple of the guys on the team, their dads were chiropractors. So anytime there was a neck injury or back injury, I'd go up into the stands and be like, hey, come down here and take a look at this. Cause I had no real knowledge of spine or back. And so I'd watch them work, do their thing, do some soft tissue work, get guys that were basically unable to move back on the ice within seconds of just applying some treatment. And I thought that was really cool. And so I applied to Chiro. I got in. I did my 4 years, but there's a sports fellowship program after you're done Chiro. So basically, you do your 4 years of Chiro, kind of like you do med school. And then when you graduate, you can specialize. And so they take 2 or 3 people a year to join this sports fellowship program. So luckily, I was able to get into that. So that's a 2-year kind of postdoctorate fellowship specialization in sports medicine. And with that, you have to do research in kind of an original topic area. And it was just kind of coincidence that Sidney Crosby had his concussion and he's going through treatment. He was out for, the better part of a year. And my supervisor came to me because we have to do these rounds presentations. So every 6 weeks, a new resident is up and they give you a topic. Oftentimes the topic's just given to you. Like my first one, I think, was on brachial plexus injuries. And my next one was on chronic low back pain or whatever. They give you a topic and you basically have 6 weeks to go through all of the research you can, put it all together and basically create a presentation and present it to all the kind of faculty and students. Here's the latest update. Here's all the research. Here's what we currently know. Here's the best protocols, whatever. So I was given an open topic, and my supervisor came to me and he goes, I heard Crosby's getting treated by a chiropractor. Like, what the hell does chiropractic have to do with concussion? Like, I don't get it. He goes, find out what's going on there. And, that'll be your rounds presentation. So I started digging into the concussion research, and it just like opened this massive hole. And it was just incredible. The amount that we actually knew about it, because it was always kind of pitched to us as like, well, we don't really know a lot about it. Or if you have a concussion, you just rest. That's it. You just kind of rest your brain. And I started digging into the research, and I was like, oh my God, rest is actually detrimental to concussion injuries. There's actually treatment for concussion, and the treatment is rehabilitation. But like me being a rehab professional had never really learned any of this. So I just got totally into the idea that this injury that everyone was so consumed with, and everyone just had this assumption that there was no treatment. There's actually a ton of literature showing that there is treatment, and what we're currently doing is actually the wrong thing to be doing. But we didn't know that. And so I kind of just started diving in and just opened up this kind of black hole. And I kind of came to the conclusion that there's 5 kind of main drivers of someone with persistent concussion symptoms. So the majority of concussions are going to recover in that kind of 7 to 10 day window. But you have about 30 to 40% of people that will have symptoms that last longer than a month. In some cases, 6 months. In some cases, a year or 2 years or 3 years or 4 years. And there's treatment for it. And the treatment kind of rests on these kind of 5 core drivers of those symptoms. One of them being neck dysfunction and neck injury, because whiplash and concussion happen at the same time. And that's ultimately what Crosby's situation was, is that he had a neck injury. And once they actually located that and treated it, he's been back ever since. Right. So it wasn't necessarily the concussion that kept him out, although the concussion occurred, but he had a neck injury at the same time. The symptoms of the neck injury and the symptoms of the concussion are identical. So everyone's looking at these brain reasons why he may have a concussion. But he had a lot of rotational intolerance. Every time he would turn, he'd get dizzy. And so the neck tells you a lot about where you are in space. And that's something that we specialize in, is neck dysfunction and neck injury. And I'm like, oh my God, if only people knew that they could get treatment, and only the treatment providers knew what to do, because we have the skill set, but nobody knows how to apply it, because we've just never learned this, because it's always been this black hole. So anyway, that became my entire research focus. I switched my entire thesis towards concussion injuries, and I ended up contacting a guy named John Letty at the University of Buffalo. John Letty's a very well-known name in the concussion world. He works closely with the NFL and those types of things, publishes a lot of research. And he was kind of on this path as well. So he was kind of seeing like what different drivers of concussion, or what are these different subsets? What are the different treatment outcomes for these people? And so I reached out to him, and thankfully he took me on, and I did my research with them. And we looked at the difference between concussion and whiplash injuries, and basically found that there was no difference in terms of the symptoms and how people experience those injuries. Anyway, so I did my research in that area. And as I'm doing it, I'm going, again, nobody knows this. And here we are as rehab professionals, not being able to apply our skills to this population that desperately needs it, because right now they're being told to stay home, do nothing, sit in a dark room, don't play sports, don't go to school, don't do whatever. And they're just waiting for it to go away, but it never will, because that very treatment of resting and sitting in darkness actually makes the injury worse, and you get worse and worse and worse over time. So if anyone's listening to this and you're suffering from these ongoing symptoms and you're being told to rest, you're just being seen by the wrong healthcare professional. They're very out of date, right? That's 20-year-old advice, right? The new advice is actually to start getting some rehabilitation. So I started an organization called Complete Concussions. From that, I actually started it during my residency. And the idea first was just to train healthcare professionals, mostly rehabilitation, sports medicine people. So physios, chiropractors, sports medicine doctors, on how to actually apply these treatments, right? These are all skill sets that they have, but how do we apply to concussion? So I kind of put that all together, developed some training and courses. And the idea was I wanted to have a network so that patients looking for concussion care could find people that they know have been trained on how to do this. And so we started with that. We created a network. We're currently the largest concussion care network in the world. We have about 450 locations or so. And we started in Canada. So we have about 300 or so in Canada. And as we're doing this, it's mostly around persistent concussion symptoms, meaning symptoms lasting longer than a month, because we're applying rehabilitation. And then throughout that, the research starts coming out saying, well, actually, if you apply that rehab earlier, you can actually prevent persistent concussion symptoms. And our data right now shows that, so if you just look at the literature, if you just let people sit there and do nothing, 30 to 40% will still have symptoms at a month. And when we started applying this earlier and earlier and earlier in the process, less than 5% of our patients have symptoms after a month. So it's just, you have to intervene early. You have to start rehabilitation early on in the process. It just makes the outcome so much better. So then we gradually morphed into more acute management, right? If we could see these people, provide proper care early on, we wouldn't have this concussion problem. We'd be able to actually just get people better and back to doing what they love to do in a safe way. So then we started working with sports clubs. We built some technology around it. So we do a lot of preseason kind of testing and return to play management, making sure that people are actually ready to return to play, not just based on their symptoms. And this is something we'll probably talk about today. But when your symptoms from a concussion go away, the brain is still kind of recovering. And unless we know what the brain recovery level is, returning somebody to play before their brain is recovered is actually where all the problems start to occur, right? It's not necessarily the number of concussions you get, but it's if you're getting a concussion while you currently have a concussion, then that's when the bad things start to arise. So we wanted to take a more objective approach, determine when brain recovery had actually occurred, not just symptom recovery. And so we started applying that to youth athletes to try and prevent a lot of these long-term outcomes that are happening, that we're seeing now with CTE and everything else. But also we could intervene early with rehabilitation if people weren't recovering, right? So if you still have symptoms at 10 days, the current protocol, the current advice from the International Consensus Statement on Concussion in Sport is you need to start rehabilitation. So we have basically sports medicine, rehab professionals, physiotherapists, chiropractors, sports medicine doctors that are now working closely with amateur sports clubs across the country in the United States and everywhere else that are able to see these people early, have objective measures for brain recovery and return to sport to keep people safe. But if they are not recovering well, they're the perfect person to intervene early on and make sure that they are back playing, doing whatever they love within the next month. And that's the whole spiel there.
Yeah, no, that sounds great. Couple things popped into my mind as you spoke, and one right at the end there. So I'm as you know, I live in Nova Scotia in Halifax. Our healthcare system out here is so taxed, right? Just to get a physical checkup, or like my son sometimes wakes up and he's got a runny nose certain times a year, so we think he may have some allergy. It's like 6, 8, 9 months to get in. How are the timelines across your network? So, for example, I'm in Halifax. My son has a game tonight, and we suspect a concussion based on impact. How quickly can you get in, and how important is it to get in quickly? Like you just said, we're doing this, way earlier. Is it hard? Is there spots left open for emergency? How does that work from a user?
Yeah. So kind of the standard within our clinical network is we try to ensure that all of our clinics have availability within 24 hours. So you can get in within 24 hours, oftentimes that very day. Yeah. And the interesting thing is with the technology, so all of our clinics are connected through our system. And we have a smartphone application, and part of that smartphone application allows somebody, like let's say a coach, to run a quick concussion screen. And those results will get sent immediately and flagged to the clinic. So oftentimes you don't even have to call the clinic. The clinic will get notified right away and say, hey, we see that Johnny's suffered a potential concussion. We have some availability. Bring him in within the next hour. We can see him right away. And that's kind of how it works, because what the research is showing even more in the past 5 years or so is that the number of days you wait matters. So, and it's not even just the number of days you wait to seek healthcare care in general. It's the number of days it takes for you to see a concussion expert, somebody who knows concussion. And basically for every day that you wait, your recovery outcomes worsen. So, and we ran this on our own data too, just to confirm it. But it was basically like, if I see you on day 1, it's better than if I see you on day 2. And if I see you on day 2, that's better than if I see you on day 3. And every day that goes beyond that, the outcomes actually get worse and worse and worse and worse and worse. So it's very important to see somebody early on, particularly somebody with training. And that's why we try to make sure we can get them in right away, right? Most people will go to the ER, and that's not the wrong thing to do necessarily, because initially with the concussion, the things that we're concerned about are not the concussion, right? Because with the concussion, you can also get things like skull fractures, or you can get things like brain bleeds, right? And it's important to kind of rule those things out. Now, our clinics will assess for all of those things and tell you whether or not you should be going to emerge or not. But also what happens as soon as that injury is flagged on our system, it sends an email directly to the parents that says, here's what you do tonight, right? Can I let them sleep or can I not? Do I have to wake them up every hour? Right? These are all the questions that people have. And we send an email that says, here's what you do tonight. If any of these things start happening, emergency room. If these things don't happen, book an appointment as quickly as you can, and then we can start the process, right? So we're just kind of notifying parents and athletes what those red flags are, what indicates something more serious than a concussion. The concussion isn't the serious thing. It's the brain bleeds, it's the other things, it's the swelling, it's those types of things. But that usually comes with some pretty specific signs and symptoms that people would experience. So we just have parents keep a lookout for those particular things, tell them what to do overnight, start that process off kind of right away. And the outcomes are far better than what they will be just going through traditional kind of waiting for your doctor or GP. There was a study that was done just this past month, actually, and it was looking at BC. And they were looking at follow-up care just from physician visits after concussion. And they defined early physician visits as within 28 days. If you could get in to see your physician within 28 days, that was an early visit. And then kind of a medium-term visit was that 30 to 60-day window, so another month of waiting. And then beyond that was kind of late. And what they found was that in terms of physician follow-up, so let's say you went to the ER, you were seen that day, okay? They will essentially, what they're looking for is they're looking for the brain bleeds, right? They can't really find a concussion, right? You can't see a concussion on a CT scan. The reason they do the CT scan is because you can see blood or you can see a fracture. So they may do a CT scan just to kind of rule that out, but then they're generally going to just send you home and tell you to rest and follow up with your GP. Well, so then the follow-up, an early follow-up is within 28 days. By then it's kind of too late, right? If you're still having issues at 28 days, you're already in the chronic state. So you need to kind of follow up earlier and get things kind of moving and done. And what they found was that after that first visit, 75% of people did not receive any follow-up at all. Right. So the medical system is taxed. And that's why we've specifically gone kind of more of the private route. Now, most people in Canada, fortunately, if they have coverage through their, secondary health benefits through work, will get that reimbursed, right? You have physiotherapy coverage for the most part. Now, some people don't, and that's unfortunate. That's
and there's a limit too. Like some people, it'll be like $500 or $1,000 a year.
Yeah, but that's more than enough. That's more than enough for what we need to do. And you actually are going to get all of the other objective kind of pieces that go with it, right? Like we do physical exertion testing and that type of stuff, because what we know is that the brain at rest responds a lot differently than the brain in an exerted state. So we actually will exert people and do these types of things to make sure they're actually ready to return to their sport. You're not going to get that in a typical GP office. And we thought about going the GP route, but they just don't have the time and they don't have the resources or the equipment even to run all this stuff. And if the treatment is rehab, we thought, you know what, we're just going to be a referral network for GPs. And now about 40% of our patients come directly from GP referrals. So GPs are starting to learn that, okay, this is their wheelhouse. You go see your GP and hopefully your GP knows about us and then makes a referral into one of our clinics. And then we kind of work together, right? We do all the heavy lifting and the GP then can oversee that and make their decision with a little bit more objective data, right? When we send them the reports saying, here's what we did, it's like you get an x-ray, right? You go to an x-ray place, you get an x-ray, the GP is not going to look at the x-ray. The GP is going to get a report from the radiologist that says, this is what we found. And then the GP is going to advise based on those findings. It's the same kind of thing. We kind of handle all the other stuff, send the report, GP then can make a decision with a little bit more information. That's kind of how it works.
Oh, cool. Yeah. And I mean, I've learned stuff already, and thank you again for this. I have a 10-year-old. We talked about that. He plays elite hockey here in Halifax, and if he, we haven't talked, and he gets, some impact tonight in a game. I'm telling you, I'm not thinking about anything that you've said. I'm thinking, okay, I got to get him in a dark room and
Mhm.
drink lots of water, and he's got to rest for a couple of days, and we'll see how he is Sunday night, and then maybe we'll, schedule an appointment with the doctor, right? And you're saying that that's gonna probably keep him out longer than if I make that call and get on. Now, I've got your website here on the bottom of the screen, completeconcussions.com. Does that have lots of info regionally where they can go, where they can reach out, or is there one central area to reach out? How does that work?
No, they contact the clinic directly. So if you go to completeconcussions.com, you'll see a big button that says find a clinic. You click on
Okay.
it and it'll pull up a map and it'll geolocate to where you are based on your IP address. And it'll tell you, here's all the clinics in your area. And then you just click on it. There's a phone number, there's email, there's a, contact form. You can go through and see what clinicians they have if you're interested in a particular thing, or you can read all their bios and decide which clinic seems best for you. So yeah, it's really kind of a way for people to, that's the idea, right? Allow people to connect with trained clinics and clinicians.
Yeah, and the easier you make it, which sounds like you've done that, that it make people don't like complicated stuff, right?
No.
So my generation certainly, like if I I go down a rabbit hole on trying to sign up for something, and half the time I just give up. It's like, okay, they're asking, I'm gonna email you, a code, blah blah blah. Good.
Yeah.
That sounds fantastic. We're gonna shift gears here, and I'm gonna ask you if you remember a story, and this is something that you said triggered me. So did you ever hear the story about Mike Weir, Brett Hull, Wayne Gretzky, and I believe it was Mario in Cape Breton? Did you ever hear that story? Okay, so it's a good little hockey story and concussion story for our listeners. So it was an NHLPA put this together. It must have been in the 90s. They were all playing still. And they all flew out to Cape Breton, and it was going to be a 3v1 golf match. Okay. So you had Mario, who was a scratch golfer, Hull, who was probably a scratch golfer, I think, at that time, and Gretz was a pretty good golfer himself. And if the idea was they were going to play scramble against Mike Weir, right? So Mike's playing his own ball. They're playing one ball between the three of them. So in the 90s, that's what hockey players did. They got after it and got into the beers and the lobsters on the night before. There was an event at the course where people came in, bought tickets, and it was a good night. Man, they got to bed probably a little later than they wanted to. So off they go. Everybody goes up to the room at the resort, and Gretzky goes down to the front desk, and he said, "Hey, yeah, don't say anything to anybody about this because we don't want the press to hear it. But Weirzy fell on his way to his room and cracked his head on the side of the door going in. So he called the doctor. The doctor said, yeah, he should be fine. But what you got to do is you got to make sure he wakes up every hour tonight. So call the room. If he takes the phone off the hook, if you could just send somebody up to bang on the door, you don't even have to wait for him to answer it. You just want him to, and it's Wayne Gretzky in Canada in 1990, whatever, right? The poor guy at the front desk was like, oh my God, I better do this. Sure enough, I don't know what time they're teeing off at 9 or something. They had breakfast at 7. And the three hockey players were sitting having breakfast and coffee and whatnot. And Weir comes in just looking like a mess, right? And he's like, somebody was banging on my door. I don't know how they found out my room number, but they were banging on my door every hour. I had to take my phone off the hook. This is, of course, before cell phones, right? Anyway, so the boys start just roaring and then told them the story. And he ended up, I think, beating them, 6-5 or something like that. But it was a funny story. And then the other one, one more little anecdote.
So wait. So there was no concussion. They were just messing with him.
He didn't fall. It was Gretzky's way of saying, hey, you know what? Let's get Weirzy woke up every hour on the hour, so maybe we'll have a chance of beating him.
That's hilarious.
There was nothing, right? So but because it was Gretzky, if anybody else had done that, they were okay. that's enough. We're not doing this, right? And then the other one was Teddy Green. Do you remember that one when it was a guy by the name of Mark Lamb was playing for the Edmonton Oilers in I think it might have been the 80s, and Teddy Green was an assistant coach with Edmonton, and he got just knocked out from a hit, and the trainer goes out and he's like talking to him and comes back to the bench. They get him off the ice, and he says, Teddy says, can he go? Can he play? Like, and he goes, I don't think so, Ted. He said he doesn't know who he is, and he said, perfect. Tell him he's Wayne Gretzky. He should not go there. But that was kind of my generation. We talked about it on the phone the other day when we did a pre-call for this.
Yeah.
You got your bell rung. I didn't know what the word concussion was, honestly, until I was a grown man. I played hockey when I was, real small, and I started when I started in the mid '70s. There was full contact when you start. Like we didn't have masks or visors, and I think it was 1974 that I started. And you'd get put on a team, and you'd go out, and there'd be a game, and if you were near the puck, somebody could hit you.
Mm-hmm.
Well, that's the way it was. But it was called, oh, you got your bell rung. Oh, yeah, you gotta, But there wasn't the option 25, 30 years ago to sit based on having headaches.
Mm-hmm.
You would have been called soft. You would have been maybe cut, released, traded, depending on your stature in the game. So I'm happy because I have a little guy that's playing it now. That it's come a long way. One thing I wanted to ask here, I want to get into the three components of what you guys do is obviously the baseline testing, treatment, and rehabilitation. So if we start with baseline testing, I've always wondered, and I don't know any others. I know hockey very well. I watch some other sports, but was it 15 years, maybe 20, that they started to put in these spotters in the rink? You remember when that program came in? So the NHL had spotters, and if one of these spotters thought somebody perhaps could be concussed, they would be pulled off the bench and the team couldn't do anything about it. Now, my thought about that always was, oh, well, that's good. I think that's it's progress. At least they're starting to. But then you see instances, and I can't think of anything specifically right now, but I've seen a guy get pulled for something that I was like, I don't think he, and then I've seen ones that were absolutely should have been pulled and they weren't. What was the criteria, for the people that do this in the pro ranks, whether it be hockey or any other? Are they medical professionals, or is it just somebody watching the game that thinks, hey, you got hit hard? Do you know?
No.
That?
Yeah, no, it's usually neurologists that are hired by the league. It's actually more recent than the past 20 years. It's probably the last maybe 6 or 7. Yeah.
Oh, wow. Okay.
Yeah. That they actually introduced the spotters. I think the NFL was the first to do it. I think hockey then followed suit, but I believe that it's in a central location. So I think they have people in New York that are monitoring everything.
Kind of like the war room during the playoffs where you got guys just watching every game.
Yeah, I think in the NFL, and I'm not 100% sure on this. I think in the NFL they're actually physically present at the stadium for each game. I think they have a series of them. Like I think John Letty does a little bit of this. The guy I was talking about earlier that does my research stuff. But I think in the NHL, I think they're in a central location watching game footage. But yeah, there's a set of criteria which are concussion signs. So you hear about signs and symptoms. Symptom is something that you feel. Right. You have to tell somebody, I have a headache, I feel dizzy, that type of thing. A sign is something that you can see outwardly. So somebody may get hit, they get up and they get up weird. They get up and they look like they may be a little bit off balance. So that might be something that would flag, right? So you may think, well, the hit looked like nothing, but they look like they're off balance now. So we're going to assess that. Clutching of the head. That's another one. Or looking a little bit dazed and confused or something like that. If they get some sort of glimpse into that, where the patient, maybe he gets up and skates the wrong way or something, or, just looks like he's kind of out of it and not really knowing what's going on. That's another one. But there's other ones too. Like, I don't know if you watch football, but last weekend, the Bills quarterback, got hit and he went down. And as soon as he hit the turf, you can see his body just go limp. Right. So that's kind of like failing to protect yourself. Like, usually there's going to be some sort of protective action. Like, if you hit the turf, you might put your arms out or something like that. But if you just have no protective, drive, generally you've probably lost consciousness. Right. So they're looking for those types of things. You also have situations like the Tua situation, where when he got hit recently, his fingers clenched up. Now that's kind of almost like a post-traumatic seizure type of thing. Now there's a thing called the fencing response, which indicates that there's been a loss of consciousness. And you see it in fighting all the time, MMA. I'm actually doing a podcast next week for the UFC network, some podcast on that. So, but what happens is you see the guy in the fighting stance and maybe roundhouse kick to the head and he falls to the ground, but he's still he's out cold, but he's still rigid and in this kind of response. And then his arms start to gradually fall down to the side. That's called a fencing response. And that's just a sign of a loss of consciousness. So all of these types of things are what these spotters are looking for to see, are there any objective signs that may indicate that a concussion, has occurred. Slow to get up is another one, right? So somebody could get a hard hit and they're slow to get up, but it doesn't necessarily mean they have a concussion. They could have, fractured a rib or something, but they have to kind of look at all these things and try to just remove them from play and get an assessment done.
Yeah, well, it's progress for sure. So that happens, or, little Jonny in his U13 game, tonight gets, his head knocked off the boards, or, a goalie gets a slap shot in the head, whatever, to test. And I've heard the term baseline testing forever, ever since I, started to hear about concussions. Baseline testing. What does baseline testing mean, and what is it that it involves?
It means different things to different people, and it involves different things depending on who's doing the testing, right? And that's the thing that I think that people aren't really aware of, is that baseline testing is a concept. The concept of baseline testing is that we test you when you're healthy so that we know what to expect, right? If I provide you with some sort of test that tests your reaction time, for example, now I kind of know what your reaction time is when you're healthy. So then if you get a concussion, generally we'll see reaction time drop. It'll get slower. Okay, so now I know that there's been a change, but I also know where I'm trying to get you back to. Right? Because everyone's reaction time is different. If I test your reaction time and I test the reaction time of 100 other people your same age, you're going to have some people that are quicker than others. So we can't use normative data, right? Normative data is if you look at your blood work, right? They'll say, well, your blood result is within range. So that's a normal result for somebody your age, because the reference range is this wide and you're kind of right in the middle. That's a normal result. Well, when it comes to, concussion injuries and overall brain function, some people are really, really good at balance and other people are crap, right? Especially if you test a hockey team, I think you would probably know that there's kids on your team that are probably really good at balance and others that are not. Some people have really, really good reaction time. Some people will have really, really good ocular motor control, meaning their eyes are smooth when they look at things, and other people will be kind of jagged and a little bit all over the place. This is all function this is all brain function, right? So there's a bunch of different areas of brain function. And the idea of a baseline is that you should test those areas of function in a healthy state so that we know where you are. We can tell if there's been an injury because we see a massive difference. But then also, as you recover and those things start to recover, once you get back up to where you were, we can say, okay, now that the brain has recovered to a point that it's not just based on your symptoms, it's based on your objective brain function, right? Like I use the example of somebody breaking their arm. If somebody breaks their arm, it really, really hurts, right? They go to the hospital, you get an x-ray, you can see that the arm is broken. All right. So we put a cast on it and then we say, you can't do anything really for the next, 4 to 6 weeks. But then what'll happen is after about a week, the pain goes away. It doesn't hurt anymore. Yeah. So does that mean I can just cut my cast off and go play? No, because the symptoms don't mean recovery. Just because the pain is gone doesn't mean the bone has healed. And it's the same situation, right? But with a broken arm, we can take an x-ray and see bone's not ready yet. It's going to be another couple weeks. Bone's not ready yet. Going to be another couple weeks. And then if finally it's like, okay, bone has sufficiently healed, we can now take the cast off and now you can get back into playing sports. With concussion, we don't have an x-ray. Like MRI cannot see concussion because concussion doesn't cause physical damage to the brain. And that's, I think, where people think that it does, but it doesn't cause physical damage that's observable on imaging. So if you get an MRI after a concussion, your brain will look completely normal because an MRI looks at the structure of the brain, right? If it's the functional deficit that's occurred. So it changes how the brain functions, but it doesn't change the structure. So an MRI won't show a concussion. So what do? We have to test function. But if I'm just to test your function after the injury, and I do a bunch of different tests and I have your scores, okay, great. But where are you normally? I don't know that. Yeah. I don't know where you're at normally. So what we do is we test people ahead of time so that we know, and you have to test everyone kind of on an annual basis. It preferably be every 6 months or more, because as kids get bigger, faster, stronger, their scores are gradually going to go with that and improve, right? So if you test someone, today and you don't test them for another 2 years, you're going to be comparing them to a score from when they were 10 and now they're 12. That's a lot different. That doesn't mean anything, right? So we do it every year. And preferably we do it every 6 months, but we're just trying to get people in the habit of doing it every year. And then in terms of what it is, it really comes down to the tools that you use. So it's kind of a contentious issue in Canada, right? There's been a group that's come out that created this document about baseline testing, and they actually discouraged baseline testing. So the only group in the world that is anti-baseline testing is this group that created the Canadian concussion guidelines. So a lot of sports clubs have actually been discouraged against doing baseline testing, but it's actually the one thing that can help make better and safer return to sport decisions. Because like I said, it's not the concussion, right? Like even if you look at the NFL or NHL, the concussion spotter, that's great because you get the person out of that game. But what matters even more is when that person's allowed to return back to sport. Now, the reason is because when you get a concussion, you go through this kind of drop. So like I said, it's a functional injury. You get a drop in the energy levels within the brain. That's what changes the brain function. And now if your energy levels are already low and you get another concussion, now you drop even lower. And at some point, if those energy levels get low enough, the brain cells start to die. So then you actually get permanent neurological injury. But if you get a concussion and you go down in that low energy state, and then you let yourself get all the way back up to your normal energy state, if you get another concussion, the research shows that it's just another concussion. It doesn't add up. It doesn't start to create that cumulative effect. But if you get a concussion and you're in your low energy state and your symptoms go away while you're in your low energy state, you might go to your doctor and your doctor says, so how do you feel? Oh, I feel fine. All right, go. They sign your letter and away you go. But you're actually in this very vulnerable period where if you get another concussion, boom, now you drop way down. Now you're potentially creating permanent neurological damage. And what happens after that is the recovery time goes from a few weeks to now a few months if you've had those two in a row. So it's not necessarily that the concussion is the problem. It's the multiple concussions in a short period of time that's the problem. So how do we stop that? We stop relying on symptoms and we start relying on more objective ways of returning someone to sport. So we take all of these baseline measures, right? And like I said, the baseline that you're doing matters. Some people may just do something called a SCAT. A SCAT test is a basic sideline tool. The SCAT test normalizes, meaning it goes back to normal within 2 to 3 days after injury. Meanwhile, the concussion takes 3 to 4 weeks to recover properly. So the SCAT test, although it's decent on the sidelines for maybe picking up some dysfunction, it's not going to be good as a return to sport measure. And if the purpose of baseline testing is for return to sport, then the SCAT is a useless baseline, right? So what you have to do and what we've done is we go through the literature and we find tests that correlate with brain recovery. So tests that have really good sensitivity and also what we call longevity, meaning that they can detect dysfunction even after the symptoms go away. So because if the test normalizes when the symptoms go away, then it's not doing you any good. What you want is, okay, symptoms are gone. but we're still seeing deficits. Okay, that's a good test, because then if that correlates with the recovery of the brain, these are tests we can use. And you need to test multiple areas of brain function. So we test ocular motor tracking, we test neurocognitive function, we test executive function, we test things like spatial awareness and those types of things. We test reaction time, we test ocular motor tracking, so how your eyes move and how quickly you're able to kind of move your eyes back and forth between various targets. We test balance and postural sway. We test a whole variety of things so that you have every area of brain recovery, because some person may be more affected in their balance, some person may be more affected in their visual function. So you have to test all of them, because then you're like, well, your balance is back to normal, your reaction time is back to normal, but your ocular motor tracking is still off. So you're not there yet. I know you feel good, but your arm is still broken and our x-ray shows it. But without having that information, you're literally flying blind into this situation. So I think it's actually a really big disservice that this particular statement did in youth sport, because it's discouraged, because, the average hockey organization doesn't understand all of this. And so they see this that's pushed to them from Hockey Canada or whatever, and they say, oh, we're not supposed to do this. We're not supposed to do baseline testing. Meanwhile, everywhere, like in the CDC, for example, in the United States, they say baseline testing should be done annually after age 10 years old.
Yep.
It should incorporate a variety of different measures. So that's the CDC. Right? The international consensus statement says that baseline testing can be helpful and add valuable insight, right? The only group in the world that says that we shouldn't be doing this is the Canadian group. And so unfortunately, Canada is actually now becoming a step behind, and parents and young athletes and sports organizations are being told not to do the one thing that can actually help, because remember, it's not the concussion that's the issue. The concussion will recover if you handle it properly. But if you don't handle it properly and you just use your symptoms as a guide, hey, I feel good. Yeah, okay, my doctor gave me a letter, because remember, doctors don't really have much training in this area. They'll just say, okay, symptoms are gone, fine, I'm going to sign your letter. You give it to your coach goes, great, you got a doctor's letter, sweet. Meanwhile, what the parent doesn't realize, what the kid doesn't realize, what the doctor doesn't realize is that brain recovery has likely not happened yet. And you're basically cutting your cast off and going out with a broken arm. What's going to happen, right? The arm's going to get broken again, and it's probably going to be worse than the first time around because you didn't take care of it. And that's really what we're trying to get across, is utilizing the best battery of tests that test a variety of areas, that have good sensitivity, good longevity, that outlast symptom resolution, and using that to help people make better, safer return to sport decisions.
Yeah, cool. Very, very, very well said. And I totally, I can't see how it could be a bad thing to do, to give each patient or kid or athlete, a benchmark. This is, right. Hey, this is normal, right? You get a head injury, we're going to test you, and we're going to compare that data. Right. How is that bad?
And how does it not make the most sense in the world? Right. So it's crazy to me that anyone could think that this would be a bad thing. It can only make things safer. Having a baseline will never make you get cleared for sport faster. It can only ever hold you back a little bit longer.
Yeah.
And what we know about brain recovery is that's a good thing. Right? If somebody comes in and I put them through physical exertion testing, and there's actually a test we use called the Chicago Blackhawks test that I actually got from my relationship with Dave Boland and the Blackhawks medical staff. But it's a really intensive physical exertion test. We get people jumping and spinning and doing all this stuff to try and elicit any symptoms. And then in an exerted state, because we know that the brain is different at rest than it is in exertion, then we test them on all of these different functional metrics. So if I see that you're in an exerted state, back to everything, I'm like, okay, I'm not concerned. I'm going to clear you. But if your reaction time is still slow, your balance is still off, now I can actually tell a parent, hey, look, what do you think? Here's where they were. Here's where they are. Do you think they're ready yet? And then the parent goes, yeah, I get it. Right. But without that, you have nothing really to tell somebody to hold them back. You can't just arbitrarily say, oh, well, they're not ready yet. Well, why not? Why aren't they ready? You need that objective information. So, and the really crazy thing is, I mean, one of the drawbacks obviously is that a full baseline needs to be administered in person, and there's a cost to that, right? But again, if you have coverage for physiotherapy or chiropractic on your health insurance, it gets billed as a physiotherapy assessment. So you can actually submit it. So you're going to get reimbursed for it. But for those that don't have coverage, okay, there's a cost. Generally, it's in the neighborhood of like 60 to $100, depending on where you're at. Okay. So, but you do that every year and whatever. Some people will get reimbursement, some people won't. I think it should just be a mandatory part of the hockey registration, right? You're registering for hockey, you just up the price by $60 and everyone gets this. There you go. It's done. But we also have a free version of this. So we have on our smartphone application, anyone can download this. If you go to the App Store and download Concussion Tracker, it's free. And in that app, it has neurocognitive testing and postural sway testing. So you hold the app against your chest and you close your eyes and you go through a series of stance positions. And it measures with the gyroscope and accelerometer inside the phone how much sway there is in your position. These are free and unlimited. So if anyone is listening to this, you don't even have to go into one of our clinics. You don't have to pay any money. So I don't know why any sports organization in the world wouldn't say, you know what? Everyone downloads this app. Everyone does the neurocognitive testing. Everyone does the balance testing. And then it pairs with the coach's app and a trainer's app. So you can have trainers on your bench that have a complete roster of your team. And then if somebody gets some sort of injury that they're suspicious about, it walks them through a quick concussion screen. And part of that is, okay, neurocognitive, I pass it back to the athlete. It's a quick little test that they do that compares to their baseline and shows deficits immediately right there on the sideline. And it's all for free. And so then, and then also if you need a clinic, then it tells you where the closest clinic is and you can call them and book in and get things going right away. And they can analyze that data as well. And then it's now you have kind of a companion to help you kind of get back to sport. But as you're doing this, it also notifies the coach. What stage of recovery are they on? Are they allowed to participate in practice? If so, what drills are they allowed to do? And all of this is communicated from our clinic directly to the phone. So the coach knows, hey, Johnny's allowed to practice today, but he's not allowed to do these drills, but here's the drills they want us to do. And then the coach can tell us, hey, Johnny did great today, not complaining of any symptoms, whatever. So now the coach is involved in the actual care and everything. So it's almost like you would be in an NHL franchise, right? You'd have the team doctor and the trainer. They'd communicate with the coach. Hey, all right, this guy's coming back. Let us know how things go, whatever. And now they're communicating, but now this all happens kind of digitally where we are the healthcare team and you are the coaching staff, and we're going to communicate with you and help get this athlete back in a more holistic way. And we're all working together and we're communicating. I mean, that's how it should work.
Yeah, I'm with you 100%. I still, listening to you, I've learned so much already, but there's still going to be people out there. I mean, there's certain programs, as we all know, and hockey is in the business of winning. You're still going to have athletes that'll come back early because that's just the type of person they are. I'm going. I'm not going to let my teammates die. And you got coaches and management that'll push here. And unfortunately, you probably have parents that don't want little Johnny to miss too much hockey because then he'll be behind the rival kid in scoring or whatever. So there's a lot of noise and a lot of like traffic to break through for procedures and protocols and whatever.
The thing is, sometimes you have to protect people from themselves in a way, right?
Yeah,
like, I mean, you
absolutely.
look at like let's say seatbelt laws, right? There's a lot of people that still don't wear their seatbelt because whatever.
Yeah.
You know what? But it's a law now, so you have to do it, right? And so that's going to gradually over time kind of, manifest into this is the way it is. Because once parents understand why you're doing it, and that's one of the things we do first on our first initial assessment, we explain to them what a concussion is, right? It's not brain damage, right? It's a temporary deficit in the energy levels of the brain, which changes how it functions. So there's certain deficits. Reaction time will be slower. Vision will be slower. So that means if you go back now, you're in this low state. But not only that, your ability to get out of the way of a hit, your ability to see the ice, your ability to perform, to actually do well when you go. Like if you go out there now, your reaction time's off, your visual tracking's off, you're going to look like crap anyway. And if you do get hit, which is more likely because you're not able to respond as well, then you're talking about making a cumulative damage. And now the recovery isn't just, okay, you're going to miss the next week. You're going to be out for the next 3 to 4 months. And then what happens if you don't want to do that? This is what happens when you hear about people that had promising careers that had to retire because of too many concussions at age 16. It's not because they had too many concussions. is that they had too many concussions close together that they didn't allow for that recovery to take place. That's just the way it is. But if parents understood that yes, okay, Jonny doesn't get to play this weekend, but he'll be able to play for the rest of the season. And if I let him play this weekend, he could actually miss the rest of the season or potentially the rest of his career. So what do you want to do? Do you want to go and risk it all for this weekend? Or do you want to actually be smart about it and say, you know what? We're going to take our time here and we're going to sacrifice this weekend for the rest of his career. And I think that's a much smarter decision. And when you show people the science and you explain this to them, most parents, and I've had angry parents in my office several times that are like, what? Come on. Right. And people will try to doctor shop or they'll threaten, but I always will just explain to them why. And ultimately, I think most people get it and they go, yeah, okay, you know, I'm being foolish in thinking that I'm going to, you know, whatever. And so it just takes that bit of time to get into it. But I think the first step has to be that hockey organizations need to stand up and say, we're going to add better protocols to our management. And that's it. That's step 1. And then from there, it'll become just part of how it is. And will be a lot better. And the concussion problem will be much, 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 much more reduced because it's not the concussion that's the issue. The concussion is going to recover. The brain will recover. But if you don't let it recover, that's when the issues start to happen.
So I want to get into treatment and rehabilitation, but before that, I got a couple of. I want to pivot a little bit and talk about. And I think there may be surprises on this list. I may be wrong, but yeah, and it doesn't have to be in order. What are the top 5 sports that concussions are prevalent? I think we know, but I think there may be some surprises for our listeners.
Yeah, it really depends on the country, right? So if you're looking at the United States, it's football.
Yeah.
Okay. If you're looking at the UK, it's rugby.
Yeah.
If you're looking at Canada, it's hockey.
Yeah.
Right. So it really depends on the location. And most of the data comes out of the United States. So when you put it all together, United States doesn't play a lot of rugby, but rugby generally from when you make everything else equal, because generally what they'll do is they'll calculate number of concussions per athlete exposure. So an athlete exposure is either participating in one practice or one game. So it'll be like, here's the number of concussions per 1,000 athlete exposures. And rugby generally beats football, right?
Helmets.
Yeah, but the helmet doesn't prevent concussions either. That's another kind of misconception, is that the helmet sometimes makes concussion problems worse because people are more likely to put themselves into harm's way where their when their head's in the way. Or, you know, those stupid Guardian caps that they have in the NFL, which I can get into that if you want. But
we talked about that on the phone. Yeah, I remember.
Yeah. So, where was I going here? So you have rugby, football, but football oftentimes is swapped with girls soccer. Girls soccer in some studies, and my thumbs up here, girls soccer sometimes is higher than football in terms of its concussion risk. And that goes across the board. If you look at any male female sport where the rules are the same, basketball, females will have twice the amount of concussions as males. Soccer, females will have twice the amount of concussions as males. Even if you look at a sport like hockey, where the male sport is full contact and the female sport is not, females have the equal number of concussions to males.
Wow.
Right? So females are twice the risk of concussion.
Why is that?
We don't know. There's a bunch of theories. There's theories around hormonal fluctuations around menstrual cycles, because there's a drop in progesterone, particularly kind of leading into menses. And when that occurs, that increases inflammation and things like that. Anyone who's had PMS will probably tell you that they feel bloated and headaches and whatever else. That's potentially due to that drop in progesterone. Okay. And if you get a concussion in that time period, it may be more likely to occur. It may take longer to recover. There's a theory around head to neck ratios, meaning that women have smaller necks and your neck stabilizes your head. So potentially you're able to get concussed with less force if your neck can't stabilize your head well. But that's, not really showing in the research, but it's a theory. There's theories around reporting bias. Maybe women are just more honest than men and more likely to tell somebody when they have, and then so it just creates a reporting bias where it looks like they're getting more, but they're actually just reporting more. Although that also has been questioned in the research, basically saying that they're just as likely to report as men are. So We don't know. We just know that it does.
Wow, interesting. So, and so we talked about soccer, and people traditionally call soccer a non-contact sport. My son plays so that's not a non-contact sport. They're banging around, they're jumping up, trying to head a ball, and there's lots of options for injuries there. But if you talk about the other sports, say hockey, football, you know, we've got American listeners and viewers, but predominantly Canada hockey families, things like that. In your expert opinion, and I've always been on the side of, and I'm an old school guy, traditionalist maybe, and I think about, myself and my journey as a kid and learning, how to avoid a hit and play in traffic and not get my head taken off at a very young age. There's some thoughts that say, let them hit from the beginning. They're less likely to get hurt because they're littler. They bend better, blah, 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 blah. And then when they get older and that size disparity happens, the little guy has been hitting for 5 years or 6 years or wherever it is. And he's able to, put his body in a better position to really not get hurt. That's always been my thought. But, where would you say an ideal time to start body contact would be in hockey for sure? And where would you say tackle football should be started from an age perspective? I know it's loaded because I get it, but I think that's something that people talk about, and
Yeah.
hear that from you, and
Yeah. So when I was a kid, it was Pee Wee.
Yeah.
Right. That's when we started hitting. And, recently in the past 10 years, it's kind of shifted away from Pee Wee to Bantam.
Yeah.
And I think in some places, have they gone to midget or minor midget? Are you aware?
Not out here, not anywhere I know right now.
Okay. So, I mean, I don't actually mind the Bantam, because when they first did that, I thought, this is stupid. I thought, this is so dumb, because, and it mostly came from knowing Bantam hockey teams, right? They would come in to get their baselines, and you'd see, one guy walk through the door and be like, hey, how you doing? 6'2", grown man with a full beard. And then you get the next guy coming in on the same team being like, hi, I'm here for my basement. And you're like, Jesus, this kid's going to get murdered out there. Like, this is when you want to introduce hitting. This is ridiculous. Okay. And this is as a concussion expert in that time. Now, since then, the research has proven me wrong. And so I've changed my opinion on that, because there's a few reasons. When they first came out and said that if you remove contact from Pee Wee hockey, you reduce the concussion risk by about 60%. Okay, that's substantial. And I thought, yeah, but what's going to happen in Bantam? Are we just going to rise it by 60%? Because then we're just breaking even here. And you're now talking about smaller kids getting hit by really big kids. Whereas in Pee Wee, they're still roughly the same size. They haven't had that huge size discrepancy yet. I actually had the same thought as you. Put it back to novice, right? Let the U7s learn how to hit when they're super tiny, and it becomes
part of the game. Half of them can't stop, so they're running into each other anyway.
Yeah. But then you learn to skate with your head up. You learn to hit when you're smaller, and it's not going to be as violent, and it just becomes part of the game. And because when you get to Bantam, there's some guys that are real excited to get into the hitting game, right? They're going out there to take off heads. But if they've been doing it, it's kind of like drinking in Europe. You can drink a lot younger when you're in Europe. No one really cares. And so when they become 20 years old, they're kind of over it, right? Whereas North America or the United States, you wait till 21, and they're off to college and they're doing dumb things, right? So it's kind of the same idea. So I was on that camp with you saying, let's introduce it earlier and potentially, soften things up when people have those size discrepancies, because they're used to it now. They're not gung-ho and ready to murder people, but also they know how to take a hit and they know how to get out of the way of one. But then the research came out looking at Bantam. So when hitting was introduced, it didn't reduce performance in any way. So by delaying hitting by a couple of years, you didn't reduce the ability for them to play and score goals and do things. So it wasn't reducing their performance or their abilities. It did increase concussion risk slightly, but it was far less than I thought. So you have a 60% reduction in concussions in Pee-wee, and you have maybe like a 18 to 20% rise in Bantam. Okay, good. That actually then now does make sense. I know there are some people that are saying maybe we should even move it back to midget because of brain development. So when you look at how much force it takes to cause a concussion, generally in that high school, college age, so like late, kind of 16 and above, the forces required are in the neighborhood of about 70 to 120 Gs of linear acceleration. So concussions from brain acceleration, right? This is why helmets don't protect against concussion, because you can wrap whatever you want around the head, right? The car analogy that I gave you when we were on the phone, and I'll say it right now again. But if you're in a car and you don't have a seatbelt on and you ram into a wall, what's going to happen to you? Well, you're going to bounce around inside the car. You're going to get thrown about. Now, what if you were within the same situation, but you wrapped a bunch of pillows around the outside of your car? What's going to happen when the car hits the wall? You're still going to bounce around inside no matter what you wrap the car in. So it's the same thing. Your brain is floating in fluid inside your head. You can wrap that head in whatever you want. You can put a helmet on it. You can put a big guardian cap on it, which in my mind may make things worse, actually, because there's more weight now for you to try and control. But anyway, when the head hits the whatever it is, the brain's still going to move inside it. So and all this stuff doesn't prevent concussion risk. So anyway, what I said, 16 and above, you're looking at 70 to 120 Gs. At 11 years old, you're looking at an average of 60 Gs and a range of 30 to 90. So younger kids can get concussed with far less force than older kids. So as you age up until about 25, the myelin, which is the fat lining around the cells within your brain, the myelin is not fully formed until you're about age 25. So below that, and the younger you start, potentially the worse it is, because that fat lining protects those brain cells. And if you don't have as much of that fat lining, there's going to be more potential shearing, more risk of damage. And then also, because you're younger and things are healing, maybe you get abnormal healing, abnormal processes that may change behavior and outcomes in the future. So there's all these kind of question marks. So there's a petition now in youth football from a group called the Concussion Legacy Foundation to introduce tackle football not before the age of 14. And I think that's a decent thing because
about the same age as Bantam, right? 13.
Yeah, I think that's a decent idea because you can still learn the game in a non-contact way. When you start hitting, yes, there will be increased risk. So if you introduce contact for the first time at age 14, there's going to be more concussions in the 14 age group than there were previously when contact was a part of the game the whole way through. But you're cutting off a large number of the youth concussions in the very young when their brain hasn't developed yet and they don't have as much brain protection, and it potentially creates developmental things moving forward because they're in that developmental stage. And if you're going to throw a wrench into the system now, you may impact things in the future. So I think that's a reasonable thing to consider, particularly if you can prove that flag football up to age 14 and introducing tackle football later doesn't actually impact anyone's performance or ability to play the game. The same thing we've proven in hockey, then I don't see any reason to introduce it earlier. And I think it's actually better. And I would even say that in non-elite, like if you're going house league, I'd keep it out of the game all the way through. I don't see any reason to introduce it. When you get into competitive and people are on that NHL track, well, yeah, you got to introduce it at some point because that's part of the game. And so it's a tough question, but I think we're learning more and more about it, and I think we'll eventually arrive at the best solution. So right. I was on your side. And parents that are pissed about it.
I'm just speaking of opinion, right? Just what I thought. But listening to you, obviously, has changed my mind. In a lot of different areas, and then if you look too, there's people that there's people that think that there should be no hitting and no fighting in hockey anymore. There's too much science out there that says it's bad. Unfortunately, a big part of the hockey fan base, certainly in North America, almost specifically, when you get into the States and some of the southern markets, they like that, right? That's the part of the sport that is attractive in some of these minor league towns in Amarillo, Texas, and Baton Rouge, Louisiana. They're there to see the fourth line out there and mm-hmm. drop the gloves and that kind of stuff. So I don't think the violence, so to speak, or the fighting and the heavy hitting is ever going to go away. Uh, but you're right. If you can manage it and keep the athletes concussion free or close to as they're growing up, and also have these treatments and rehab and not get them back into their sport too early. Maybe that there's guys that'll have longer careers and things like that. And then you
Well,
got to also come in, and I'm sure you've been asked. Basically, there's been lawsuits, and I know we talked about this on the phone. Before we get back into I want to wrap up with your kind of treatments and what a typical treatment rehab would look like, for an athlete. But I wanted to touch base on CTE, and it's something that's not. I mean, it's talked about. Whenever an ex NFLer, a lot of times in the hockey world, it's an ex tough guy that had 500 minutes a year in the minors, or played a little bit in the NHL and fought 40 times, and they talk about CTE. And I said this to you on the phone. I mean, I can remember waking up after a game the night before and not remembering the game. Right, like so obviously I was concussed, because it's like, what happened last night? I asked somebody what happened last night. But so I've always thought that I would be a candidate, let's say, to have CTE. Tell me your thoughts on CTE. What causes it? How it is? What is it? I don't know. I know the three letters. I really don't know much else, but I know it's out there.
this is a contentious issue.
Yeah.
So I'll kind of preface it by saying no one really knows what CTE is at this point. There's speculation that it's a brain disease due to repetitive head trauma and or concussions. However, where we're at in terms of the level of research that we have is very, very early days. So this started with people who were having issues, cognitive issues, substance abuse problems, anger issues, depression, suicide, whatever. And they would, donate their brain after they died. And so looking at the brain, they found these tau protein deposits called neurofibrillary tangles. So, and they were in a kind of a distinct pattern. So with CTE, the tau and the fibrillary tangles are generally found in distinct kind of areas. But in terms of neurodegenerative diseases, there's about 20 different types of what's called tauopathies. So CTE is a tauopathy, means we have aggregated tau in certain areas of the brain that we can see when we stain the brain with certain stuff. And then there you have it. So like Alzheimer's, for example, is the most well-known tauopathy, right? So CTE is another tauopathy. So we've cut open the brains, we see this tau. Why is it there? Well, it could be there for a variety of other reasons, right? Is this just a new subtype of neurodegenerative disease, right? This tau deposition in these areas, is this just a basic age-related neurodegenerative disease? I don't know. Is it related to substance abuse? I don't know. Is it related to genetics? I don't know. But people have really latched onto the idea that this is due to head trauma. And it may be, but we haven't proven that yet. And it's very difficult to prove because there's so many things that happen throughout the life of an individual that could ultimately lead to this type of situation, that it's very hard to try and pinpoint causation on one particular element. Now, and when I say we're early days, I mean we're early days because we have a lot of athletes that have donated brains, but we don't have a lot of normal controls that never played contact sports. So what's the prevalence of CTE in control brains? Maybe I have evidence of CTE. Like maybe you do, maybe you don't. Okay. Now, the scary part for me is that when you dig in further, oftentimes the symptoms that people experience in life don't correlate with the neurodegenerative findings they find post-mortem. Meaning there's been several cases of an athlete, former athlete, who's thought they've had CTE. They've committed suicide. They've donated their brain. and they don't have CTE. Okay? Because the symptoms of CTE are very what we call non-specific, meaning that there's a whole bunch of different things that can cause the same symptoms. So just because you have these symptoms, if you've had a couple concussions, you immediately associate it with CTE. And then you start feeling like, well, there's no way out. There's no treatment for this. I don't want to become a danger to my kids. I don't want to become a danger to my family. And I have severe depression and substance abuse and other things, and they commit suicide. There was a study that was done actually on former hockey players. I think they had about 150 brains. The most common cause of death was suicide. CTE was only found in 40% of the cases. So 60% of them potentially committed suicide under the belief that they had this, and they didn't. So that's the scary part for me, is that I think we're significantly jumping the gun on this because the symptoms are nonspecific. They don't often line up with the pathology. And oftentimes the cases that are diagnosed with CTE have one little speck of tau in the brain somewhere. There's no way that that one little speck of tau can account for all this wide variety of symptoms. So there's a couple studies that have been done recently, which I think kind of point to what I'm getting at here. One was a study by Grant Iverson, where he actually looked at normal, healthy control brains with no history of contact sport participation, no history of head trauma, and CTE was found in 6 out of 8 of them. So how, if it's related to concussions and head trauma, how are we finding it in people with no history of that?
Right.
What if it's just a normal variant of a disease that's existed forever, and we're finding it in these professional sports bodies only about half the time? But how often are we finding it in the normal population? Well, we don't know because we haven't really done a full investigative analysis of it. Secondly, the symptoms. The symptom profile. So if somebody has the symptoms of this in life, it's called traumatic encephalopathy syndrome, because we can't confirm CTE until we actually have the brain, right? There's no way to diagnose it other than, oh, you have these symptoms. And so there's a diagnostic protocol. So a couple months ago, a study was done looking at what the prevalence of TES, traumatic encephalopathy syndrome, is in former NFL players. They found that over 1,000 NFL players, the number was 7%. So 7% of former NFL players met the clinical criteria for traumatic encephalopathy syndrome. Then they did the same study looking at 1,000 people with no history of head trauma or contact sport participation. It was higher.
Yeah.
It was 30% in the male group. 30%. So if you think about it that way, playing in the NFL is protective against the very symptoms that they're attributing to the head contacts that they're getting. So is it head contacts or is it a mental health issue?
That's where I was just going to go.
Right.
When you
so
talk about substance and anger.
When you are a professional athlete, there's all sorts of other factors we have to get into, right? Why is it the fighters and enforcers? Is it because concussions? Or is it because they're constantly giving pain-killing medication to continue to do what they do? One correlate of tau protein in the brain is opioid medications, which are painkillers.
Yep.
So if opioid medications cause tau, and we're giving these professional athletes opiates and painkillers to be able to, a shot of Demerol here and there to get back out there, what's that doing from a cognitive perspective? The other correlates, so when I said 7% of the NFL players, all of the cofactors that were associated with that 7% had nothing to do with football. It was, they were more likely to be anxious, depressed, have low testosterone, right? Low testosterone is likely attributed to potentially steroids and other things they did earlier in life, because that's going to affect your testosterone production as you move forward. So that could be a factor. It was associated with substance abuse problems and all sorts of other factors. Playing football was actually not on the associated list. But when you're a professional athlete, and you go through and you're, a hero in your teens, and you get into the OHL and you get into the NHL, and then all of a sudden you're 27 years old and you're cut, or you're too old. What do you do now for the rest of your life? How do you give yourself purpose to move forward into that? Right. So I think what starts to happen is 5 to 6 years later, you're kind of lost unless you've kind of figured out something else you want to do. And I think then the depression sets in and the other things start to happen. And immediately they think, oh, the CTE is happening now. And once you start thinking that you have this, you're going to see evidence of it everywhere. Right.
Well, and I can see it being an excuse too, right? It's like, oh, well,
potentially an excuse, but like, I'm driving home from somewhere and my wife calls me on the phone and says, hey, when you go to the grocery store, make sure you grab some avocados. We're out of avocados. Yeah. Okay. No problem. You go to the grocery store, you completely forget to write it down. You go in, you do all your shopping, forget the avocados. You come home and your wife goes, where's the avocados? You immediately go, oh, that's more evidence that it's CTE. Meanwhile, I do that shit all the time. Like that's a regular occurrence, right? I misplaced the car keys. Where are the car keys? CTE, right? Whereas if you haven't had that thought, you just attribute it to what it normally is just like everyday forgetfulness, right? I'll check the garage door 3 times before I go to bed because I just want to make sure it's closed. But I'm like, I think I checked that, or you lock the house and you leave and you're like, did I lock the door? Just because we do things sometimes on autopilot, we can't remember all the little things we do, but somebody who has the thought that they may have CTE is immediately going to start to use that as evidence that this is happening. And then what starts to happen is like anxiety and depression set in, and those things themselves cause cognitive problems. You can't think straight when you're anxious. You can't think like if you've ever had a panic attack before, you don't know what's going on. You're in a panic. Yeah. And I think a lot of this can be chalked up to kind of mental health issues. But I think what's happening is this whole narrative around CTE is being pushed onto these former athletes, unfortunately, and they're starting to internalize this and it's ruining lives. It's actually kind of ruining lives. But if we thought about this and actually educated them to say, this is what we know, this is what we don't know, here's all the other potential causes, let's treat those and see what happens. Right. Because I guarantee that a lot of these cases can breathe a sigh of relief knowing that it's not a foregone conclusion. We don't know everything about this yet. And there's potential treatments for the other symptoms I'm experiencing. Maybe I can feel better. And now I don't have to, go through, unfortunately what a lot of happens is, suicidal ideation.
Right. And the nice part about it too is, in the last 10 to 15 years, mental health, particularly men's mental health has been really, really come to the forefront. You got the Bell Walk, Let's Talk days and the all kinds of different, the Movember is another one, that kind of stuff. And they are diagnosing and treating a lot more mental health issues now than they ever were, right? There's clinics that you can get in, and I always say, we talk about it, on the Bell Let's Talk, if you need to see somebody, go see them, right? Like, don't be ashamed to go see a mental health professional if you have some of these issues, instead of saying, oh well, I played football.
Yeah.
I played football as a kid, so I'm
gonna be I mean, the number one, and the other thing too is the number one kind of theory, this might be getting a little bit into the weeds here, but the number one theory around CTE and its association with concussion is that concussion causes an inflammatory kind of cascade within the brain. And that inflammation, so if every time you get a concussion, you're having inflammation in the brain, inflammation is associated with neurodegenerative disease, right? They're looking at Alzheimer's right now and calling it diabetes type 3. So Alzheimer's potentially is a metabolic condition because of high blood sugar and high inflammatory markers within your system that are causing damage to the brain. So you pair that with concussion and then aging and also poor diet and obesity. So the majority of former NFL players, it's like 50% are in the obese range of body competence, but they also have high inflammatory markers to begin with. There was a study done looking at NFL draft picks coming into the NFL combine. They looked at their omega-3 scores. They looked at their inflammatory markers. They looked at their magnesium levels, and they had high levels of inflammation at baseline, right? And so a lot of this, you think about just chronic inflammation in our society causing heart disease, blood pressure issues, diabetes, all this stuff is associated with inflammation and metabolic disorders based on the foods that we're eating. So if you take somebody who's had a couple concussions and they have inflammation, one of the first things we do in our concussion protocol, and I know we're going to talk about treatment in a second, but one of the first things we do is we put people on an anti-inflammatory diet. We cut out all the pro-inflammatory foods and we say you have to eat like this for the next few weeks, because that helps the brain to recover and lift the fog of the concussion and everything else. But what happens is, if that's not happening in professional sport, which I don't think it is, right? Everyone's carb loading and doing all this stuff. Then if that continues into life and you're not considering diet and inflammation and regular exercise and prioritizing mental health and meditating and doing these things and having a purpose and having friends and a social network, if you don't prioritize that stuff, the inflammation as well as the social withdrawal and all the other things start to impact from a mental health perspective, because a lot of mental health conditions are also associated with inflammation. Depression and anxiety go up when inflammation is high. So we could probably do a lot, not only just to say, hey, get your mental health checked out, but if you are concerned about this, right? And we teach this within our course too. If you have somebody who's concerned about this, the treatment is, let's start doing regular exercise. Let's find purpose. Let's find something that we enjoy to do, a hobby, something like that. Let's re-engage with social connections. Let's start eating super clean, super healthy, right? We're going on the Tom Brady diet. We're going to be, inflammation, just killers. We're going to go out there and do it. Those types of things can not only improve your overall health, but your brain health, and potentially stave off or even reduce the chances of having any type of neurodegenerative condition. And so that's really the approach that we take, is when you get a concussion, take care of it, right? We're not concerned about the concussion. We're concerned about the multiple repeat concussions in a close window. So let's take care of each concussion. Let's also get rid of inflammation if you've had a concussion history, and let's continue good exercise, keeping your body weight down, low BMI, all of these other things, that healthy life, healthy brain.
Awesome. Now, yeah, and fantastic information. And I wrote down here to Google anti-inflammatory foods, because I would have no idea what you even mean. And honestly, and just speaking from my own case, right? Maybe I need to do that too.
It's worth it. Like, I know, so for example, I've had asthma my whole life.
Okay.
Exercise induced asthma. I'd always just take my puffer before the game, and that was it. And then I started actually getting hives when I exercised. I would go for a run and I'd get all blotchy and I'd break out into these hives, like having an allergic reaction. Go to your doctor. They're like, oh yeah, here's an EpiPen. Take a Reactin before you run. That was the solution. So we have a naturopathic functional medicine doctor who's on our team. And so I was like, what do you know about, so it's exercise-induced anaphylaxis is what they call it. So I said, what do you know about this? He goes, it's all gut. It's all related to your gut health, because histamine is an inflammatory marker. If you have high levels of inflammation, you have high levels of histamine, and you start having allergic reactions, right? And I've always had lots of allergies too. So anyway, he's like, here, he puts me on this diet for gut repair and just low inflammation. And literally after a week of doing this, I just remember I was like, wow, I feel so clear and so sharp. And I could run without needing my inhaler, without breaking into hives.
Oh.
I never need my inhaler anymore, because I just changed the way I eat. And it's actually insane, because the amount of fog that just lifts from your brain, I was like, how many of my concussion patients are reporting this mental fog and they can't concentrate, they can't remember anything? It's related to diet and inflammation. So now that's one of the first things we do. And people are like, holy shit, I feel so much better by just getting rid of some of these foods and eating.
So give our listeners 3 things to avoid and 3 things to absolutely have a part of your daily diet.
Okay. If you're an athlete, if you've had a concussion, or if you haven't, you should be taking creatine monohydrate daily.
Okay.
5 grams creatine monohydrate. Everyone associates that with bodybuilding, but basically what it is, concussion drops your ATP levels, your energy. Creatine is exogenous ATP. That's why you're able to do more work, because it gives energy to your muscles, but it also puts energy in your brain. It improves cognitive function, but it also improves brain recovery after concussion, particularly if your stores are good and high before you do it. Okay. From a supplement perspective, everyone should be on omega-3s, because our diet is very high in omega-6. Omega-6 is the inflammatory one. Omega-3 and omega-6 work in opposition to one another. So if your omega-6 is higher, it's going to be the dominant one. But if you get your omega-3 higher, that's going to be better. So omega-3s would be a supplement that everyone should be taking. And then magnesium. Magnesium is one of those things that used to be very prevalent in our diets, which is not anymore because of our farming practices, right? We don't do as much crop rotation and that. So the soil is kind of depleted of magnesium. So you used to be able to get it from leafy greens and nuts and seeds, and you don't get it as much anymore. So everyone should be supplementing with magnesium, because what magnesium does, it is actually like a neural calming agent. Not only will it improve your sleep and improve your recovery and improve your heart function and all this other stuff, but when a concussion occurs, it blocks a calcium channel. And calcium is one of the biggest things. Calcium is what gets into the cells within our brain and prevents us from producing ATP. So if your magnesium levels are adequate, you can actually reduce the amount of calcium that gets in and have a better recovery after concussion. So those are kind of some supplements that any athlete that is involved in high risk sport should be taking on a regular basis.
How young?
I want to be careful to not be too prescriptive, right? This is not medical advice. Talk to your healthcare professional.
For sure.
But these are things that are very safe, high safety profile, and have all upside, very little downside, if any.
How young would you start an athlete on supplements?
I would think kind of like post puberty. I think like around that bantam age would probably be a good place to start, just because that's usually when you're starting to put on muscle and grow a bit. And so I think that's a reasonable time to do it. But that's also when you're getting involved in contact sport. So I mean, everyone's individual, and talk to your healthcare provider and all that stuff, and not medical advice. But yeah, I would think that's a reasonable time to engage in that. But creatine is also going to help your performance off the ice. It's going to help you with training and weight training and putting on muscle mass and that type of stuff. So I think it's just a good all around supplement. It's got a super high safety profile. Some people, it can create some GI symptoms. You might get some bloating and stuff, and you can just change brands often and find one that doesn't do that to you. But in terms of diet, after a concussion, we cut out refined sugar. Okay. That's the number one thing. We get rid of anything that has sugar in it.
Okay.
We remove all processed foods. So we remove, chips, processed meats, ham, sandwiches, and whatever like that. We get rid of the processed meats. And then we get rid of any common food allergens. So a lot of people don't know that they may have a gluten sensitivity. And so we remove gluten and we remove dairy for a bit, because a lot of those are the most common sensitivities. And people often don't know they have it until they remove it for a bit, and then they add it back. And then, oh my God, I got a headache as soon as I ate that gluten, right? Or my God, all bloated. But you don't know, because every day you just kind of feel like that because you're eating gluten every day. So we will do, right off the bat, we will go no refined sugars and carbohydrates, no processed foods, like no crackers, no chips, no anything that's gone through a processing plant, anything that comes in a box or a can or anything like that, it's processed. And then remove gluten and dairy. And we do that for 4 to 6 weeks. And then at the flip, so basically the other, okay, what can I eat? Whole fruits and veggies, high quality meat and protein. So high quality, grass-fed steaks, if you can afford it, ground beef, fish, chicken, whatever, just high quality meat, protein, and fruits and vegetables. And that's your diet. You're just going healthy. You're just going straight healthy. It's going to reduce the inflammatory effects of the concussion injury. It's just going to help all around. And that's generally what we put people on when they have persistent symptoms too, because inflammation is one of the drivers of persistent symptoms. So we put them on an anti-inflammatory diet on day one. Oftentimes they're like, holy crap, I feel so much better just by, eating clean for a bit. Like, it just lets your gut repair, and it does so much for health benefit. And we should all ultimately be eating like that every day anyway.
Interesting. And great advice. So, we kind of pivoted off, and now I want to get back, and so I'm going to give you a scenario, and I know every kid's different. Every injury's different. Right. But I just kind of want to get you to walk me through, I'll use say a 14-year-old AAA hockey player, has a big impact in a game, dizzy, right? So he goes in, they get on your website, they find the local provider, they get in within 24 hours, they go and say, yeah, your son's concussed. He, obviously, the trauma that you brought him in, great. I'm glad you're here, this quick, because it's going to help. Now there's two other categories here. You got treatment and rehabilitation. So what are the differences, because I could see them meaning the same thing, right? You're rehabbing or you're treating the injury. So if you could, let me know the difference and just walk me through. And again, you got to be generic because we don't know, right? There's levels of everybody's different, but just give me an average, what it would look like, timelines, and that kind of stuff.
So I'll separate it into acute, meaning
Okay.
the injury just happened within the last 3 or 4 days.
Okay.
And then I'll separate it and do chronic, meaning kind of the more persistent symptoms. So the injuries happened 10 days ago or longer.
Okay.
It could have been 6 months ago. The treatment protocol is the same. Okay. So if you're an acute injury, we're mostly focused on returning you back to school, sport, work in a safe way.
Right.
So let's say you come in that day. First thing we're going to do history. What happened? Tell us what's going on. We're going to go through those red flags and make sure there's nothing that it would warrant you having to go to the hospital for a CT scan. We're going to do a neurological examination. So we're going to look at your cranial nerves, meaning like sensation in your face, the ability for you to stick your tongue straight out, the ability for you to do facial expressions. Because what you can, if somebody's got a cranial nerve thing, you may see some droopiness in the face or those types of things. You're looking kind of more for like stroke-like signs, if you want to say that, right? Slurring of the speech and these types of strange situations. Cranial nerve screens, cerebellar testing, which is basically motor coordination. So point to point, right? You might have somebody touch my finger, touch your nose back and forth, follow my finger. I'm looking at how smoothly your eyes are tracking. Can you do all the different directions, or are your eyes stuck in any area? So those are cranial nerves. That's a neurological examination. Then we're going to look at your neck, because oftentimes with concussion comes neck injury. And so one of the things we're concerned about is, could there be a neck fracture here? Again, that would be emergency department. If we kind of rule all that out, again, the first initial assessment is not worried about the concussion at all. We're looking for the things that are more serious than a concussion. If we rule all that out, then we can say, okay, we're into concussion territory. We'll take a symptom score. We'll look at the results that came in through the application to see what your scores were. If you have a baseline, even better, because then we can just easily compare it right there, right? You have your preseason, but then you also have this one that happened right here on the sidelines. Here's the deficits. We can see it right there. And then, okay, we've diagnosed the concussion. Concussion has happened. And now we're getting into kind of treatment and rehabilitation, right? And I'll talk about the differences in a sec. First thing we do, here's the diet plan. Well, first thing we do actually is we educate. Right? We teach them, this is what a concussion is. This is why it's important. This is why even when you feel better, you shouldn't try to go and play with your buddies or wrestle on the playground or anything like that. You just need to take care for a couple of days. The treatment is not rest in a dark room. The treatment is just take it kind of easy for a day or two. You can still do household chores. You can clean your room. I want you going on walks every day for at least 15 minutes outside. Right? Get the sun on your eyes, go outside, get some body movement. You need to keep your body moving and somewhat active in a light way for the first couple days, because that actually gets things moving. It helps clear inflammation. It helps lift mood. It helps lift energy. It does all these really good things. Bed rest does the opposite. It actually dysregulates your autonomic nervous system and makes things much worse. So don't do bed rest. Don't do dark room. It's unnecessary. The recommendation right now is to still kind of limit screen time. We find that people who fully avoid screens and people who don't limit screens at all do the worst. People that still kind of somewhat, watch a little bit of TV or go on their computer or whatever, that's fine, as long as you're not going to do it for a sustained period of time.
So stay away from the extremes, right? Don't
stay away from the extremes. Yeah. Stay home from school for a day or two. And then once you're, after that first day or two, now we're starting to kind of push you a bit. So then we have you start doing what's called light cognitive activity. So we want you reading a book for 20 minutes, trying to go to school, pick up some homework, start doing some homework. Once you can tolerate 45 minutes of cognitive activity without increasing your symptoms, then we send you back into half days of school. Once you can tolerate half days of school, then it's full days of school. And then we gradually lift, some of the restrictions. Generally, when we send you back to school, we say no tests, no homework, no gym, no recess. Those are the 4 kind of main categories. And then after we start lifting those. From a sport perspective, after the first week of you doing your own kind of light activity at home, we bring you back in, we put you on the treadmill. We do something called the Buffalo Concussion Treadmill Test. The Buffalo Concussion Treadmill Test assesses the level of balance within your autonomic nervous system and your ability to tolerate exercise. If we start ramping up the treadmill test and you start to get symptomatic, it means you're exercise intolerant. You're not ready yet to go back and do non-contact practice. If you pass the test, meaning you're able to get to full exertion with no issues, that means exercise is not a problem for you. So now you can go back and start practicing with your team in a non-contact way, right? Put the red shirt on, get out there, do some passing drills, any drills with contact, just remove yourself from them, and they're going back. This is where we communicate with the coach, right? The coach sees the list of drills through the application. They pick hockey, here's the drills. They know what they're doing. Then once they've done a couple practices and they're feeling good and their symptoms have gone away and they're back to full-time school, we bring them back in. We do something called a Chicago Blackhawks test. And it's a physical exertion test where we put them on the bike. They do kind of a series of hill climbs and sprints on the bike. Then we put them on the floor. They do lateral hops. They do jumping with 360-degree rotations to try and get them, see what their vestibular system's like. They do some burpees so they get the up and down, see if that elicits anything. If not, then we take them into the room and we run all their baseline retesting again, ocular motor function and all this whole battery. And then we compare. All right, asymptomatic at rest, asymptomatic with physical activity, has been on the ice with no issues, is back to full-time school with no issues, just passed the Chicago Blackhawks test with no issues. And I'm looking at their baseline here and everything looks good except reaction time. Okay, I know you feel better. We're almost there. We're so close, okay? I'm going to keep you out for another couple days. I want you to come back in a couple days and I'm just going to test the reaction time because I just want that to line up before I give you the final go. Okay. And that's the process, right? Unless all systems go, if all systems are go, they're gone. We clear them. Okay. So that's acute. Now, what can happen in the acute is that we hit the 10-day mark and they're still really symptomatic. Well, now we have to find out why, and we have to treat that. Or if they come in and it's been 6 months and they're like, hey, I've had this concussion for 6 months and I just don't know what to do. Everyone's telling me just to rest. I've been off work. I've been off school. I'm not doing anything. I can't play sports and whatever. So then our process is a little bit different. There's 5 main causes of persistent concussion symptoms. Number 1 is autonomic nervous system. So your autonomic nervous system is your fight, flight, or your rest and digest. So one's called the sympathetic. That's your fight, flight. The bear is chasing me. My pupils dilate. My heart rate kicks up. My breathing rate increases. The blood goes to my muscles so I can get away, right? And then you have the like calm, relaxed, parasympathetic state, which is called rest and digest. That's where your pupils constrict, your breathing rate slows, your heart rate slows, your digestion kicks in, saliva gets produced, your gut starts to work, and that's where you digest your food. These 2 systems work as a teeter-totter. So if one is on, the other is off, and if vice versa. Now, what happens after concussion is your sympathetic state gets stuck. So people end up in this, pupils are wide. So guess what? They have light sensitivity. Their hearing becomes more sensitive because they're trying to get away from the bear, even though they're not. They can't sleep because they're anxious and agitated, right? All of these things, they're not digesting their food well, inflammation. So we have to figure out if that's the cause. And we generally do that through the Buffalo treadmill test and some other things that we can do. If that's the cause, the treatment is generally exercise, breathing activation, things to try and calm the nervous system, teaching maybe meditation, getting out in nature, grounding exercises, those types of things just to calm the nervous system down, get out of the fight or flight. Exercise is one of the best tools for that. Meanwhile, this kid's being told to rest. Exercise. Rest imbalances your nervous system even more. It makes things worse. So exercise is the way to do it, but you have to do it in the right way. So we run a treadmill test, we figure out what your threshold is, and then we give you an exercise protocol. That's step 1. We also give you the diet actually at step 1 as well. Okay. So you get the diet, anti-inflammatory, go, go, go. And then step 2 is we take a look at your visual vestibular system because number 2 on that list, I said autonomic was number 1. Number 2 is inflammation, gut, and hormones. So that's where we fix your diet, fix your digestion, get you sleeping better, all those types of things. Number 3 is your visual or vestibular system. So vestibular is your balance system. That can become messed up after concussion. So in that, we do an assessment and we treat whatever's there. So we figure out, okay, when I get you doing this, it elicits dizziness. Okay, I know what this condition is, and there's a treatment for that. Generally, it's rehabilitation. Rehabilitation and treatment. Rehabilitation is generally exercise-based. Right. So we give you some exercises to do. Treatment is more so like manual or hands-on stuff. If I have to actually treat you, I'm treating you versus you doing rehabilitation on the exercise side. That's the difference there. Number 4 is neck injury, right? The Sidney Crosby thing. Neck dysfunction causes the same symptoms. Your neck tells you a lot about where you are in space. It also causes a lot of the headaches. Most headaches that people experience after concussion are actually due to the neck injury that they sustain, because you get something called referred pain. So if you have a lot of tension in one of the muscles of your neck, you'll actually feel it as pain in your eye or in your forehead. And they'll attribute that to this headache, but it's actually a neck injury. So we'll get in there, push on some stuff. If I can recreate your headache by pushing on your neck, I know exactly where it's coming from. Loosen that off, headache goes away, dizziness and balance start to go away. Great. So that's number 4 is neck. And then number 5 is the mental health side. So people get anxious if they've had symptoms for a while. Pre-existing anxiety and depression is one of the biggest drivers of persistent symptoms. So we have to address that. And oftentimes it's just education. If we educate someone that your brain isn't damaged, right? Persistent concussion symptoms are not due to ongoing brain injury. They're due to dysfunction in one or more of these 5 systems. And this is the playbook and how we're going to systematically go through each one of these and apply a treatment for you. Then they go, oh God, thank God. And then the anxiety lifts. And now all of a sudden they're starting to feel better, because anxiety can cause the same symptoms. It can cause the mental fogginess. Anxiety can cause the sleep dysregulation. It can cause the raised heart rate and the dilated pupils, because it impacts your autonomic system. So it all works together. And so it's just finding someone who really understands that and just applying those in a systematic way to address each of those potential 5. It doesn't matter what your symptom profile is. It doesn't matter. It's one of those 5 things. And that's all we do. We just systematically attack those 5 things, and the symptoms just lift and lift and lift, and away we go. That's it.
That's awesome, man. Like I said, but I've learned so much in the last hour and a half or so. I encourage lots of families that are listening here. Reach out, get on the website here, get on CompleteConcussions.com, learn more. There's lots of information, lots of stuff that you can dig around and be ready. Do the baseline test, right? Why wouldn't you get out there and get your child tested so they know what to compare it to? It can only help. Hey, I appreciate all the time that you spent here. Like I said, I'm a hockey dad. I know you have your daughter starting out and your little guy next year, and having guys like you around kind of helping to make the health of our kids long term better. Because at the end of the day, I mean, there's some people that may disagree with me, but that tournament next weekend with your 10 or 11 or 12-year-old kid isn't as important as being able to function and play these sports long term. So any closing words? We'd love to drive some traffic to what you're doing, and hopefully we can help some people and some families.
Yeah, I mean, I think you kind of nailed it there. I think that remember, don't be concerned about the concussion itself. Make sure you take care of it, right? Don't be concerned about the broken arm. The broken arm will heal as long as you let it heal, right? Be concerned that your kid's going to cut the cast off and go and play and re-injure it, because then it's going to be worse. This is the same situation, right? It's not the concussions that are the concern. It's not taking care of it that's the concern. It's getting the second one while you're still recovering. We can mitigate that by seeing a concussion trained provider versus just going to your family doctor. There was a study that was done a couple of years ago that found that there was very little education, if at all, in most Canadian medical schools on concussion. So there's a very good chance your doctors never learned anything about concussion. And unless they've taken a personal interest in it and have gone through the literature, they're going to give you potentially incorrect and harmful advice. And if you're just looking for a signature on a piece of paper to get your kid back to sport, you have to be considering, what is the brain actually recovered? Is this actually the right thing to do? And the best way to mitigate that is not only seeing a concussion trained provider, but having a really good quality baseline test. And the best way to do that is to find one of our clinics and get it done. But if you don't want to do that, or maybe you don't have coverage for physiotherapy or chiropractic or whatever in your benefits plan, you can do the app one for free. So the app one is, go to Concussion Tracker. So go to the App Store, iOS or Android. It's downloadable anywhere. Concussion Tracker. You'll see our little brain logo. I don't have a picture of it with, actually it's behind me right here. It's on my shirt. There we go. I got 2. You'll see this logo. Click on it, download it, create a profile, and you can just do baseline neurocognitive and balance assessments. And those ones we actually recommend you do regularly. Like, do that every 3 or 4 months, because then what happens is we have AI algorithms now that actually will create a range of normal for an individual, so that actually gets smarter and smarter over time. So that's the free version. Anyone can do that. There's no cost to it. There's no catch. There's nothing. We just wanted to have a tool where people could do this with zero kind of risk to them. And then now they have those results. And if something does happen, you're going to be thankful that you did. It's like an insurance policy in a way. Sometimes you don't need it, and hopefully you never do. But when you do, my basement just flooded. I'm definitely glad I have insurance.
Yeah.
And so I think it's the same way. And if people just start thinking about it the right way, and the more education we can do to let people know that, concussion is not the concern. It's the repeat concussion. It's, if you have a concussion, take care of it. I think that's the best thing we can do.
Awesome. Well, again, thank you so much. Thanks to our sponsors, of course, Bjorn Sports and Don Cherry Sports Grills, and very exciting. And let's catch up again if anything new comes down the pipeline. There's a new lawsuit or people are talking about this. I'm certainly going to reach out and get your opinion on that kind of stuff. But again, I appreciate your time, and keep doing what you're doing. You're making sports safer for lots of kids out there. Appreciate it.
Yeah, this was fun. Thanks for having me.